because the kinds of stories that you're hearing tonight, that you will be hearing tonight, as Jane said, they don't just happen in the UK, they happen all around the world. And the reason why they happen all around the world is because we have an international drug control regime of which the United Kingdom is a part. So it doesn't matter which country you live in, we are all commonly bound globally under the same international drug control system. So the types of problems and crises and failures that we're seeing in this country, we're seeing around the globe. And this is why we're calling for change on an international level, and that has to start for us locally, to the national level, to the international level. In academia, I work in public policy, and policies always start with a fundamental question, and that question is, what is the problem? In terms of drug policy, the problem was defined 100 years ago. And this is the system that we still live with today, a system that's over 100 years old. It's quite extraordinary. There's very few other areas of policy that I'm sure any of us can think about where we're trying to deal with modern, complex, international, transnational challenges which were actually defined in a period of colonialism, in some cases slavery, and where women were still not able to wear trousers. And yet that's the age in which drug policy was conceived. The problem at that time was a problem called opium, and the opium trade was something that Britain really made most of its money from, and it's how Britain managed to fund its empires overseas. And the opium trade was seen as being, by the turn of the century, one of the most debilitating international problems because of problems of opium addiction, and also because opium was seen to be a profoundly immoral trade. So drug policy and drug control began with a meeting in Shanghai in 1909. And after 1909, the international community, right through up until the final convention of 1988, has worked to build an international control system. The most important of these international conventions is the 1961 Single Convention on Narcotic Drugs, and then all of our national legislations fall from these international conventions. What the international system aims to do is to create two types of drug markets. The first drug market is the market for legal drugs, and that legality is determined by their medical and scientific utility and importance. The other market is what's defined as the misuse market, the recreational market. And the whole focus of international drug control is really on eliminating this illegal market. So the dilemma that we have is that so many of these drugs that Joe was talking about before have a dual use purpose. They can cause enormous harm, but they are also of tremendous medical importance. So how do we confront this dual use dilemma? So this is the way that drug control works. It's creating a system, it's trying to create an international market where we have just enough amounts of drugs to meet medical and scientific requirements, but then everything else is eliminated and repressed. This system has been a profound failure. It's based on a series of assumptions and policy approaches which over time have proved to be completely flawed and ultimately counterproductive, but we have persisted with them because we simply don't know how to change or revise the system that we currently have. The world is locked into a global policy model that we simply cannot change unilaterally because the whole of the system will in turn unravel. So what are the fundamental assumptions of this model which have proved wrong, and how do we know it's proved wrong? Well, we know it's proved wrong because right now we have the highest ever level of illegal drug consumption. Drugs are now cheaper, they're now purer, they're more widely available than they have ever been at any point in the history of the control regime. Last year, Afghanistan produced its highest ever level of opium poppy harvest. Colombia produced its highest ever level of coca. We had record levels of production of cocaine and of opiates. So clearly this system isn't working. The whole focus of this system, as I said, has been on repression. And the way that this repression has been conducted, the way that law enforcement, because this is a model of law enforcement, we're trying to repress. So law enforcement has been executed in a way that profoundly disadvantages on the basis of race, on the basis of class, and on the basis of a global north and south divide. Whenever we talk about who are the world's leading drug producers, everybody always sticks up their hands and says it's Afghanistan, it's Colombia. The reality is that the world's leading drug producers are countries such as the Netherlands, the countries that you very rarely hear about. And the reasons why it's countries like the Netherlands is because we have seen this tremendous surge over the last 10, 15 years in synthetic drug production. So the majority of the drugs that are consumed globally today, it's not the coca, it's not the opium poppy, it's synthetic drugs, chemically manufactured drugs. And yet the whole focus of the control regime and of law enforcement has overwhelmingly been on preventing the supply of coca, cocaine, opium poppy, and opiates. So the system's no longer fit for purpose. We have no early warning mechanisms. It has completely missed the rise of these synthetic markets. We have more of these synthetic drugs coming out of the Netherlands, Central Europe, out of China, out of India, and yet the focus of international attention remains Afghanistan and Colombia. What we try and do when we're repressing people's behaviour is to impose on them draconian, punitive punishments, criminalisation, incarceration. Today we have the world's highest level of drug-related incarceration than we have ever had in any point in history. Countries execute people, take away people's children, incarcerate, people lose their jobs, their house, but it's not working. We have, as I said at the beginning, the world's highest level of drug use than we've had in history of the control regime. But the key problem that we have here is that our drug policies stigmatise people. And when you try and create a policy framework around principles of stigmatisation, you are creating a public health crisis. This crisis means that people cannot access the services they need. It means they're scared to come forward for support. It means that people don't want to come forward because they're worried about possible criminal or police behaviours. And we also see overwhelmingly that people, particularly women, don't want to come forward for treatment or help because people are worried about losing access to their children. So our argument fundamentally in terms of drug policy reform is that we cannot continue to see drugs as a security and a policing issue. Drugs are a health issue, they're a development issue, and they're an education issue. And we need to shift this agenda away from the idea that this is about policing, and we need to adequately train doctors, nurses, clinicians to understand this as a public health crisis. Now, the reason I got interested in drug policy before I turned to the issue of students is precisely the opposite of the reason why the families today are here. Because I lost somebody who was loved very much, a family member, to cancer at the age of 35 years old. And when she was in the Marsden Hospital in London, I met families from all over the world in the waiting room, as you do, as I'm sure you can imagine, when you go through these many long hours of people's cancer treatment. And the reason why people had come from all over the world was because it was impossible for them to get access to opioid analgesics. Morphine is not available in around 75% of the countries worldwide. The bulk of medical morphine for pain relief, for palliative care, for treatment of people with terminal illnesses is simply unobtainable. It's only a few countries globally which are consuming legal medical morphine stocks. And the reasons for this is because the controls around access to morphine are so tough, so difficult, that most countries simply don't bother requesting the opioid analgesic stocks that they require. So on the one hand, we have a system which punishes too harshly and causes stigmatization and public health problems, but this system is also failing on the other side. It's failing to get people the access to the drugs that the World Health Organization recognizes as being essential medicines.